So the StITCH project is all about working together, local and national partners, international experts, and community health workers to make hepatitis care part of everyday health services.
The key lesson here is that interoperability is really evident in different health sectors.
So let's continue to work both together to make early screening, timely treatment, and better awareness a reality in every community po.
Good day, everyone, and welcome to the 19th session of UPM SILab Webinar Series IOL 2025. And today, we're excited to bring you a special webinar session about the Strengthening Integrated Treatment and Care for Hepatitis in Primary Healthcare, or the StITCH project, as we observe the World Hepatitis Day last July 28th, just this Monday. And for that, we have two esteemed resource speakers from the StITCH project itself and learn about the CQI, or the Continuous Quality Improvement, and of course, their Telementoring Series in the project. Please join me in welcoming our first speaker, Ms. Jae-Ann Sumalo. Over to you, Ma'am Jae-Ann.
Good day, everyone. Thank you for joining in this webinar series entitled Connected for Care, the StITCH Telementoring Series. And I'm Jae-Ann Sumalo from the StITCH project. Now let's take a closer look at hepatitis B here in the Philippines. So it remains a big health problem in our country. So many Filipinos have it, but most of them don't even know they're infected. This is dangerous because hepatitis B can lead to liver cirrhosis and cancer if not detected and treated early. Not enough people are being tested, and so our goal is to increase awareness and access to testing, especially in communities and health centers. We need to catch it early before it's too late. Just like hepatitis B, hepatitis C is also a serious concern. So around 4 out of every 1,000 Filipinos may have it. The problem is that hepatitis C usually has no symptoms for years, and people find out only when the disease is already serious. It's also a major cause of liver cancer around the world. Nasaan na ba tayo ngayon? Unfortunately, in the Philippines, only about 11% of hepatitis B patients have been diagnosed. And this highlights gaps in access, awareness, and systems that StITCH is aiming to address. We are working closely with local rural health units and community clinics to help them to screen more people for hepatitis, treat eligible patients early, and monitor outcomes, all through guidance and mentoring. So the StITCH project stands for Strengthening Integrated Treatment and Care for Hepatitis in Primary Healthcare Level. We believe that frontline healthcare workers like midwives, nurses, and doctors in rural health units can be empowered to diagnose and manage hepatitis with the right support. This initiative is being piloted in 2 countries. In both areas, we're working on building political support for hepatitis programs, creating clearer policies, ensuring enough resources are available, and training and mentoring health workers so they can confidently provide hepatitis services in the communities. One of the key activities under the StITCH project is the Telementoring Series. This is an online program made for frontline health workers like nurses, midwives, medical officer, and medical technologists who are working in local health centers. So this is a telementoring format, short and quick but very meaningful for the participants and as well for the mentors. Since ang mga mentors natin is from Hepatology Society of the Philippines, they're very busy. It's a bi-monthly session. So every other week, the participants from the RHU, it's either a midwife, doctors, or nurses, they will present their cases. It's a real case that they encountered during their community activities and as well training in their respective RHUs. Ano ba yung impact nito sa healthcare providers? Midwife gained confidence in managing hepatitis case. The RHU staff became proactive in identifying at-risk patients. Impact naman nito sa patient and family. So again, early diagnosis prevented mother-to-child transmission. Thank you very much sa DOH kasi sinuport nila yung mga medications at talagang nagbagsak sila ng mga gamot sa pilot sites and basic laboratories. The family became more conscious and proactive. For the community impact lang po, i-share ko lang. Of course, yung birth dose vaccination ensured po sa newborn. So sa mga medical mission po, kasama na rin po ang hepatitis po. And as well sa mga community activities nila na halos po thrice a week po ay kasama na ang hepatitis. Doon na rin po sila nag-screen. So kasama yung medtech doon. Turning you over to Mr. Timothy Mercado for his discussion regarding CQI.
Our discussions on this part would be just complementing what Jae-Ann mentioned, covering lessons learned from the continuous quality improvement on the ground in terms of And in relation to monitoring and evaluation, there is a fragmented approach in terms of prioritizing viral hepatitis B or C in different regions within the Philippines. As you could see here in this slide, we have different phases. So we have pre-awareness and testing, linkage and initiation of care, and ongoing care and recovery. Across this cascade of care, what you could see here are some of the baseline data that we have, the different challenges mentioned by people with hepatitis and healthcare workers. During pre-awareness and testing, there is limited availability or knowledge regarding the services of hepatitis. And in terms of linkage and initiation of care, there are many significant challenges in terms of affordability and availability of the necessary services and medications for them to continue to care. There are few opportunities for training or capacity building for healthcare workers. What is continuous quality improvement? So basically this involves a systematic data-guided activity to evaluate the performance of a process or a program with the goal of designing interventions to improve performance or outcomes. The output of a continuous quality improvement would be learning and informed action. In terms of interoperability, I think this could be related to the agile process within the software dev field. One method for a CQI would be PDSA. So that would be the Plan, Do, Study, Act cycle. This focus on iteration of interventions. Why does it matter in the public health sector? Of course, for interventions to work, we would like to reduce system inefficiencies. The end goal would also be to optimize resource use and ensure that programs remain people-centered or client-centered, data-driven, and adaptable. A key factor for a Plan, Do, Study, Act is that it also promotes accountability. So how did we do the PDSA cycle here? We are conducting monthly CQI meetings to determine the problem within the cascade of care. For doing, of course, we implement the plan on a small scale and documenting what happens during the implementation. For study, we test and review the performance metrics. Of course, we have our program indicators. Last but not the least, we act. We decide whether to adopt, adapt, or abandon the change that we identified, and of course, plan for the next cycle. So what you see here would be the progression of linkage to care rate over time since the start of our project implementation. What would be important of CQI is that we addressed system inefficiencies. And more than that, we focus on the end user. So who would be our end users in this case? That would be our healthcare workers or our frontline healthcare providers. The key lesson here is that interoperability is really evident in different health sectors. Once integrated ang isa't isa sa interoperability, that is also evident in the public health sector.
That brings us to the end of today's session of IOL 101, Connected for Care StITCH Telementoring Series, and lessons learned from CQI on the ground. Thank you all for actively participating, and let's continue to collaborate and learn together. See you next time. Bye!